Okay.
Oh, I understood it.
Sorry about that. We're now live.
Excellent. Right. Well, good evening, ladies and gentlemen, and welcome to the Adults Health and Social Care Scrutiny Board on Thursday, the 11th of August, on this very extremely warm day. So I seek the board's forgiveness for not wearing a tie on the one occasion of the year that I do not wear a tie. So my forgiveness on that particular element. I'd like to make a special welcome to Anne Flanagan, who's the interim head of Adults Health and Social Care. We always like to make people feel welcome here in Calderdale, and hope you actually may consider not leaving and finding a position here. So welcome to Calderdale. You'll find it an extremely welcoming place, and with some challenges as well. So we like to give a few challenges. So a special welcome to Anne for coming this evening. Okay, so substitutes nominated for this meeting, and apologies for absence. We have Councillor Helen Rivron for Councillor Kingston. So thank you, Helen, for attending once again. You're extremely welcome at these meetings.
Thank you.
Yeah, no worries. And I have apologies from Councillor John Ford. Anyone else with apologies or substitutes? No. Okay, so item number 2, members' interests. Just remind members to declare any disclosable pecuniary interest at any time. You can do that either now or when any item occurs. Item number 3, admissions to the public. It's not recommended that the public be excluded from the meeting, and anyone listening from the public, you are most welcome and hope you enjoy. So item number 4 is minutes of the meeting held on 30th of June 2022 to be agreed as a correct record and signed by the chair. I certainly would propose to have a second. Thank you, Councillor Hutchinson. All those in favour of those meeting minutes? Okay, thank you. Right, excellent. We're quickly getting through the agenda, so we can then enjoy the sunshine at the end of the day. So item number 5 is the Interim Director of Adult Health and Social Wellbeing. So said, Anne, welcome to the meeting. The floor's yours for the time being.
Many thanks, Councillor. Thank you for such a warm welcome. I'm Anne Flanagan, and I am the, as you've said, the Interim Director, and it is very interim. It's for a very short period. As you all know, Ian Baines left the authority a couple of weeks ago, and there's a permanent appointment been made. Kath Gormally joins the authority on the 3rd of October. So I'm covering this period in between and getting a very detailed handover together for Kath. Kath and I have worked together and have known each other for many years, so feels really pleasant actually. So we're going to have regular weekly catch-ups between now and when Kath takes up post, so that she can hit the ground running and isn't overwhelmed with a gigantic handover when she arrives on October the 3rd. So I'll be leaving at that point. I live in Calderdale, so I'm delighted to be working where I live for a change. I tend to work very far away from home, just finished a contract in Southampton. So this is a real pleasure for me to work where I live.
Oh, excellent. Sorry, thank you for that. No. There we go, technical problems. Right. Yeah, no, thank you for the introduction, and I'll probably open it up to members if they've got any questions. Just tell me how long you're actually physically here for. I think it's literally a few weeks, isn't it?
It's 8 weeks, and it's 4 days a week, but I've spread those out to accommodate various different things. So I'm here for 32 days. And I will finish with a couple of days detailed handover with Kath on probably October the 4th.
Okay, so superb. It'd be quite, if you're willing to do so, I'd be quite happy to have a meeting with myself as the chair and Councillor Barnes as the deputy chair, just to see where we can help and assist, really.
Lovely, that would be great, thank you.
Yeah, superb. So perhaps I'll get Mike or Bella to find some dates in our very busy diaries, I'm sure. So members, any particular questions, any burning questions at the moment? I'm looking around and nobody's showing their hands. So you've got, yeah. Well, you know, first of all, we wish you all the best with the preparing the handover. It's a challenging time when you come into an authority. So I'm sure you'll make Kath very welcome when she comes in for the interim handover. So I'm not seeing anyone wishing to raise any questions, so let's move on. You're more than happy to stay for the rest of the meeting, of course, but if you are busy and have other items that you need to attend to, then I would understand equally. So item number 6, which is the CQC assurance framework, and I'd like to welcome, I'm just looking around, and Jill, you're always welcome as always. Thank you for attending the meeting. Do you have anything to add to the report that you've already produced?
I'll just give a very, very brief overview, Chair, because I know members that have had councillors have had an opportunity to read the report. So essentially, the Health and Care Bill has introduced a new CQC requirement to regulate CQC local authority social care services for adults. This new inspection framework will come into being from April 2023. It is important to say that the framework isn't finalised yet, and it's still being developed, and we're not anticipating the final published framework until the autumn of this year. The new inspection framework will focus on 4 priority themes, which are working with people, providing support, ensuring safety, and leadership and workforce. And they will collate evidence across 6 key themes, which will involve feedback on people's experience, feedback from partners, and staff and leaders, observation processes and outcomes and performance data. And there will be a series of questions which will focus on safe, effective care in responsive and well-led services. So the priority for us as a local authority, as an adult social care service, is about how we now prepare and become inspection ready for that new framework. So what I've done in the paper is outlined the 4 priority areas that we have set ourselves as a directorate, and those are systems, policies and procedures, inspection readiness, which encompasses all of that, and workforce. And I've outlined in detail under each of those headings in the report what steps we are taking to prepare for that inspection process. So there is a significant amount of work ahead for us to get ready. Some enormous challenges, as well as significant reforms coming in, such as the care cap reform as well, which will basically see an increased demand for adult social care provision. But I'll pause now, and happy for Anne if she wants to add anything to the introduction to the report, and happy to take any questions.
Would you like to add something to that?
Thank you, Jill, and thanks for all your work on this to date. As Jill said, it's pretty challenging, and you've made reference to that, Chair, that we have our challenges post-COVID with the very significant rising demand and need for support from adult social care. We've got the social care reforms coming, which are going to be pretty challenging, as I'm sure you've already discussed. We have some projections from a national exercise from Newton Europe on the likely impact, authority by authority. There's huge variation across the country on that. And we've got the work that we've been doing for some time in Calderdale. You've all been leading for some time in Calderdale around making sure that we deliver the services for people with the best, that's going to give the best possible outcome. So there is a lot going on, and there are other papers coming through to Cabinet imminently around some of the other changes. So I think it is fair to say that it's challenging. It is not insurmountable. We need to plan. We need to be as prepared as we possibly can, and we need to be really thorough around the inspection regime. I don't think we'll be, touching wood here, I don't think we'll be an early authority for inspection. I've had some discussions with ADAS and so on, and I think we will be a bit middle of the pack. That gives us a bit more time to prepare, but we are waiting for the detail of the single assessment framework to come out in the autumn, and we know that the autumn can mean anything from September to Christmas Eve, really. So we don't know when that's going to be available, but we need to be ready by April, just in case we're one of the early authorities to go. So we are getting on with this now, and Jill and colleagues are working hard on that.
Excellent, thank you for that. Councillor Hutchinson.
Thank you, Chair. I've got a couple of initial questions, if that's all right.
Mm-hmm.
Obviously, the adult services are largely provided by independent providers. I'm not really clear how much of the Care Quality Commission's assessment is into the performance of Calderdale Council per se, and how much will be into the providers of the service. And alongside that, how many providers do we actually work with?
I'm happy to answer that if that's helpful. I'll defer to Jill on the number of providers. I don't know the answer to that one, but the current CQC arrangements are focused on our provider services, our registered provision. The change is that we will now, as a local authority, also be inspected. So we are going to be subject to an assurance regime. It's not new. We have been inspected in the past under a different arrangement, and we've had sector-led improvement for a number of years. I think Jill's outlined that in the paper. So it's not new that we are under an assurance regime, but this particular set of arrangements is new for local authorities. So we will be subject to inspection as a local authority. There's also going to be a shift in that the CQC will also provide an assurance framework for the whole of the integrated care system. So it's quite significant change. The providers are well used to being inspected. Children and learning services are well used to being inspected by Ofsted. We are not so well used to it over the last, Jill, correct me if I'm wrong, but I think it's since 2010 the change was made. So it is quite a big change for us and quite a significant workload to prepare for that. Jill, I can't answer the question on the number of providers. I'm too new.
Okay. So in terms of number of providers, we currently have 32 care homes in Calderdale, and we have 20 home care providers that are part of an approved provider framework, and then we have 5 main providers that have 70% of the work across key localities. Then those providers have been subject to CQC inspections ongoing, so all of those providers have a current rating unless they are a new provider that's just entered the market. What this framework will change is it will introduce one single assessment framework that will be applicable to the council's social care provision and also all of our providers in the market. So we will all be subjected to the same framework.
Councillor Hutchinson, are you on mute? I know you want to have a follow-up question.
Oh, it's great to hear that it's a less massive undertaking than if it was the whole system providers and council that had to actually get used to this. You've set up an improvement and quality assurance board. I was wondering what the main gaps and concerns that have been recognised by that board, because the 4 priority areas are quite vague in terms of how they describe themselves. So I just wondered what you would be actually homing in on.
Okay, so in terms of those 4 priority areas, systems is one of the biggest priority areas for us, and that is about our adult social care system, which records all of our client data and information and provides all of our performance monitoring. So that is absolutely critical to any inspection process. And I've outlined in the report that that is currently an in-house system that has been in place for many, many years and needs significant work to bring that system up to date. So we are currently working on a business case options appraisal, which is going forward to Cabinet in September in terms of the future of that system. And that piece of work will involve co-producing with practitioners and designing a new system so that it is compliant with all of the new social care reforms, is able to produce all of the performance data required, and is basically fit for purpose for the future of adult social care. The second work stream is in relation to policy and procedures. And again, that's a significant area for us of development, in that we've entered into a partnership with a provider whereby they have a range of policies that are compliant with legislation, and then we have significant amount of work to do in localising those to Calderdale so that they are relevant to our local population but compliant with statutory requirements. The inspection readiness theme is all encompassing because all of those areas are relevant to that. But for inspection readiness, for example, there will be a series of key documents that we need to have ready for inspection, and those documents will include key strategies, for example, our carers strategy, our commissioning strategy, our market position statements. It will also include documents such as annual reports, key performance data, and we will audits of practice. So that will start to form part of a documents bank. And then there will be a piece of work around self-assessment. So for any inspection process, being self-aware and demonstrating that we are self-aware, we know where our strengths are, we know where our areas for development are absolutely key, and demonstrating with confidence that we have a plan as to how to approach those areas. So developing that self-assessment and action plan will be a key part of the inspection readiness, as will workshops around preparing practitioners. So practitioners practitioners in children's services who are used to Ofsted are used to sitting with inspectors and telling the story of the cases that they are working, and showing and demonstrating that they know those individuals, their needs. They can share how they've engaged with those individuals and how that's informed those plans. So preparing practitioners will be a key part of that inspection readiness. And then the fourth theme is around workforce. And that will be around our strengths and asset-based practice, about how we work with practitioners in terms of how they approach casework. And we use the term strengths and asset base in terms of work, ensuring that people have got greater choice, greater control, greater independence to improve the quality of the lives that they live. And also workforce, what's key with it is ensuring that we have a narrative around our turnover of workforce, our recruitment and retention issues of staff, how we engage as a leadership team and a council with our staff. And I think it goes without saying our performance data will be key to all of that. So I hope that's answered your question, Councillor.
May I just come back to the case management system that you're designing? Mm-hmm. How much interoperability are you planning? You know, we're supposed to be with an integrated care system. How much interoperability will there be with Calderdale and Huddersfield Foundation Trust's Kerner system? How much will there be with, I think it's mainly System 1 that the general practitioners use? And I know, as far as I'm aware, South West Yorkshire Partnership Foundation Trust haven't got round to having a system at all yet. But I just wondered whether this is going to be a standalone system or whether it can draw down information and feed information back up to these other systems as a matter of course.
Interoperability of systems is a key consideration for us. I would say in terms of the market currently, I'm not sure of how many local authorities have successfully managed integration with health systems, and I think the interoperability tends to come into the system being interoperable with children and young people for those transitions from young people into adulthood, particularly those young people who've got learning disabilities. So that will be a key factor in the specification in terms of that system, ensuring that any system we procure or indeed rebuild in-house has that interoperability across the lifespan.
Thank you very much.
Councillor Barnes.
Thank you, Chair. I think sort of Councillor Hutchinson touched on an element of it, but mine is in particular to 2.8 inspection readiness. I mean, that's pretty vague, and to have that as a priority when we should be inspection ready anyway as a matter of course, rather than actually have it as a priority. It should be central and core that we should be at any moment in time be inspection ready. But in particular, how are we going to demonstrate that we are self-aware? How are we going to demonstrate we have a robust self-assessment and action plan in place?
Okay, thank you, Councillor Barnes. So you're right, it's really key that we are inspection ready at any time, and I think the challenge for adults and adult social care currently is they haven't been subjected to a CQC inspection framework, I think, since 2012, but Anne will correct me if I'm wrong, and it's been led through the Adults Association of Directors. Regional improvement has been sector-led, so there hasn't been that requirement to be ready for inspection in the same way that children and young people's services has had to be. And what this will do is bring adults pretty much in line with children's inspection frameworks, in as much that we will be subject to now a regulated framework and regime. So the self-assessment that we are developing has to be an accurate self-assessment. So what we will do with that is, across those 4 key themes that I mentioned in the introduction, we will assess ourselves under each of those themes, and we will drill down into how good we are on case management. We will drill down in relation to our engagement with our service users. We will drill down into our compliance with statutory reporting requirements. We'll take into account compliments, complaints, and what they're telling us. So we will use a whole range of information to tell us where our strengths are and where we've got areas we need to improve, and put specific plans in place to address some of those. So the fact we've already identified policies and procedures means that our procedures is an area where we know we need to develop them to improve compliance. So that's an area. The work we're doing on systems is to ensure that we have a case management system that's more intuitive and helps us to better capture data and tell that client journey. And similar, we are setting up and developing quality assurance frameworks whereby audit will become more so part and parcel of everyday practice. And that audit activity will tell us our cases where we can showcase good practice, but cases whereby we know we've got themes and learnings perhaps coming out of complaints whereby we need to improve areas of practice.
Chair, can I just come back? The reason I asked the question if I was starting this job in October with this on the horizon, I would be screaming to be number one on the list. If I was a new director of adult socials, I would be absolutely screaming to be top of the list, because if you're coming into a job new, the best thing that you can have is an audit or an assessment. I don't want to be critical. I'm not being critical of anybody already there, and I don't mean to say there's any problems, but that's the document for them to make. There's no blame on them, and I don't mean that in a horrible way, but it gives them the document in which to develop and build formally. So I think that element of that is absolutely critical, and I think we should be looking at whatever we can do in place before this kicks off in April, to make sure, because if I was coming in place in October, I'd be on the phone to them and say, do me first. I genuinely think that is something that the new director may want to consider.
I'll bring Anne on this one, please. So Anne, would you like to comment on that?
Yeah, thank you, Chair. Thank you, Councillor Barnes. I don't think the issue is at all about the authority lacking insight. So I've only been here for 2 weeks, but my impressions are, if I can share those with you, that you've got some incredibly high caliber staff working in the authority, and there's really strong insight to the issues that need to be tackled as an authority. Also incredibly powerful insights into what works well, and there's a lot that works incredibly well in Calderdale. I've worked in many authorities, and it's a really positive experience to be in Calderdale. I think the issue about not wanting to go first is that this is a new regime. The CQC itself is still working out how it's going to make this work. So there are some trailblazer sites who are doing some kind of piloting. I think it's possible that for the first year, it's possible, it's not confirmed, but that the inspections that take place in the first year may be used as more of a pilot, a test and learn arrangement. So it's not so much for me about the authority's readiness for Calderdale, it's about the newness of the process and the procedures, and being, if I can use the term, guinea pig, is kind of time consuming, and we probably could do with facing our resources into the delivery end of things and letting some of the bigger authorities go first, and CQC can make their mistakes and learn from those, so that it's not such a burdensome arrangement for us by the time it gets to us. That's my view. Kath may have a different view when she arrives, but it's certainly, I'm not suggesting that there's a problem from the authority side. It's more about the newness of the regime.
I think that's probably quite a good point, because I think when Ofsted changed, and they were quite harsh when at first for the first 6 months, and then decided that actually we are being a bit harsher. So there is an element of that. So I'm going to bring Councillor Shukat in at this stage, please.
Yeah, thank you, Chair. I just wanted to just ask whether we've caught up on all our monitoring requirements that we may have fallen behind on during COVID, certainly with our external providers. And just building up on what sort of Mike said, we should definitely always be business ready and in that frame of mind of audit and delivery. Now, the prospect of a new CQC framework is quite scary in the sense that I don't know what the ramifications are. So if we are one of the early sites that are sort of visited upon, if we don't score highly, what does that mean to us as a council? What's the reputational fallout and the damage that could occur? Is it on par with CQC in a general practice? Is it on par with Ofsted? So when our CYP services so underwent that, and it caused absolute system-wide chaos for us. It was a really difficult time. So yeah, I guess I just need a bit of a sort of reassurance that we're there. And on the points about complaints and compliments, external sort of providers, to what extent do we have a relationship that we're confident that when CQC arrive on their doorstep and they ask them these questions in terms of how supportive our Calderdale Council, that they're going to say, well, yeah, you know what, they're reasonable, and they try, or are they simply going to have a list of complaints to say, no, actually, they're failing on this, etc. Sorry.
Yeah, thank you, Councillor Shoukat. Jill, would you like to answer some of that, please?
Yes, I will do my best, Chair. So in terms of how ready we are in and catch up since COVID in relation to our providers, we have developed a fairly robust risk matrix of all of our providers, and we regulate. There is a formal structured governance and assurance board that oversees the quality of those providers. There is an operational group that meets to assess and review intelligence that's coming in about providers, and that can come from a range of sources such as whistleblowing complaints. We do regular monitoring visits face to face now back out to providers. We have a team of business relationship managers that are all linked to providers. And the risk matrix to date, as providers are being inspected, we're starting to see that there are few surprises for us, because we've been able to assess and identify where there are risks to providers. We have recently put in place, we're still recruiting to some posts, but we've put in place a specific team to support providers, which is headed up by an experienced registered manager. And we're trying to operate on through the quality service, we're trying to operate on a basis whereby providers can come to us to tell us where there are challenges and ask for support, but also where through our monitoring visits we go to providers and identify where standards are falling short and presenting a risk to residents, to inspection, or where indeed there may be financial viability risks. So I'm confident we have a really robust framework in place, that I would be happy to share the principle of it with Scrutiny at another time. I think in terms of our providers, we have a strong registered managers network. We attend those networks. Providers come to us with ideas, and we do some kind of troubleshooting and solutions. I can't say problems don't arise. Occasionally issues may arise with invoices or payments or other things, but we do our best to address those issues promptly. We currently have a workforce recruitment strategy that we've developed specifically for our provider market, and we're due to launch that in September, where we are trying to do a lot more in support of our providers so that they are not competing against one another for staff, but we're trying to attract new people to the care sector, and we are building a specific website in order to support providers, and we're co-producing that with representatives from our provider network. So we have a range of support providers, a range of activity. I think generally, I presented reports last year to Scrutiny of the amount of support we put into providers through COVID, through a range of grant funding and other sources, and opened that up to expressions of interest and ideas, and we're now doing that. So if I give an example on recruitment, we've got some providers doing overseas recruitment, and we're supporting them with the administrative costs and burden of that, to expedite staff into the sector. So I feel that from a provider perspective, it would be a general positive story to sell to sell to CQC, in that they would have some really good feedback. We do have tough conversations with providers. We try to be open and transparent with them, but I think the fact that we operate on that basis where we tell them concerns, and at times we have to intervene. I think they respect our approach in how we manage that.
Thank you, Jill. I have 3 elements. First of all, I think we need a members briefing session, so a wider range as we go a few months probably down the line when we're a little bit closer to coming up with a framework. Secondly, my question relates to financial implications, and we probably don't know those financial implications at the moment, so we need to have a better understanding in relation to what are the cost implications of setting up a brand new system. And thirdly, I see this as a bit of an opportunity. So the opportunity I see this as is basically in children's services. We have I might get this wrong, so my apologies, recommendation 41, where councillors actually have this. Why don't we be a proactive council and say, actually, we're doing this on a voluntary basis? It's not being introduced as the authorities have got to do this, but I think it would be useful from the CQC point of view, saying actually our councillors have been willing to actually get involved and ask the questions. What your staffing levels? What's how many cases are you dealing with? I don't know. Food for thought. In the meantime, I'll bring in Councillor Hutchinson. Then I've got Councillor Shukat.
Thanks, Chair. On the key points on page 9, key point 7 is asking about, brings up the preparation for the new charging regime, the sort of benchmarking of costs against costs that the local authority can purchase care for, and the approach to the cap on expenditure. My understanding is that the cap only applies to the personal care aspect of care, and only to the costs incurred from the time when the system goes live, not what people have spent historically. So I was just wondering what the timeline is going to be, for actually, to my understanding, it's going to be a number of years before anyone is likely to approach that cap. Or have I got it completely wrong? But what preparations are you having to make, and with what degree of urgency? Or is it just a matter of showing to the CQC that you have the systems in place to be able to operate this new system once it does become live?
And I think you're going to hopefully answer that particular question.
And I think Councillor Fenton-Glynn wants to come in as well. I'll just say my little brief bit. It's still unclear. A lot of this is still unclear around the social care reforms, but I wonder, Chair, whether it would be helpful to bring another item to future scrutiny committee around the social care reforms and the implications and the position as we understand it to date. I referred at the beginning of the session to some work done by Newton Europe around the likely implications. They've done some analysis to suggest the financial implication by authority, the implications for staffing levels for social workers and social care staff, and the implications for the numbers of financial assessment staff and other staff for each authority. It's very early days on the reforms. There is, I think from ADAS, again, and from Chief Execs, I believe, I may have that slightly wrong, a request to delay the social care reforms because of all the challenges that we're already facing, and we don't yet know what this winter is going to bring with COVID and what we're seeing from the Southern Hemisphere, which is earlier and higher numbers of serious flu cases. So there is a balance to be drawn between implementing the reforms and dealing with what's in front of us. We're not completely out of COVID, as we all know, and we are looking probably at a very tricky winter for lots of different reasons. So I'd suggest if you're minded to, Chair, that we bring an item back at a future date to look in more detail at those.
Yeah, perfect. We'll put that on the work programme to include that. So, Councillor Fenton Glynn.
Yeah, I'd back up that suggestion from Anne there that I think something on charging reform. I know I got accused of trying to run down the clock with my answer on charging reform at full council, but unfortunately it's not simple. I'd say I think it's a very well made point there, Colin. You're right. It does. The funding kicks in from when the reform is launched to when it gets up to £80,000. I don't have the number at my fingertip. I think it's 86. But anyway, what we probably have less knowledge of at the moment, and what we're going to have to spend some time getting knowledge of, is the self-funders market, because obviously they don't interact with the local authority in the same way. And I think, we've got an idea of the shape of it, but we don't know kind of the specifics. So, we'll kind of learn that. I think it is worth underlining, and I think, we'll get into this later, but, the proposals are sort of based on DILNOT and then also not. So with the DILNOT proposals, it would be when the funded part plus the the self-funded part reached £86,000. It would you'd reach the cap. Whereas with the proposals that we have, is going to be when the individuals paid that much, which is obviously just not as simple to administer in any way, and frankly is more likely to lead to people losing their homes. So there's quite a lot of implications of charging reform that haven't been fully fleshed out yet. I'd recommend talking further about it, and I think we need to make sure that we're doing what we can. I think we're aware of, we've not done all the work, but I would say that I feel quite confident that we're aware of the challenges that are involved, and what we're going to, the steps that we have to go through to make that happen. And I think that's something where I think we're in the process of doing it. But yeah, it's not simple, because as with so much in social care, it's quite complex.
Thank you, Councillor Fenton Glynn. Councillor Shukat, sorry for keeping you waiting. Just when people indicate to want to respond, it's always important to bring them back in.
No, it's fine, Chair. It was just as I also asked about the ramifications of a poorly rated sort of visit, and I just wanted, to know whether officers whether they could shed some light. I mean, if it's a new framework, are we going to be, is it going to be, detrimental? Will people understand? So where does this sit? Because I know elsewhere, if we have, a poor CQC rating, it's a big deal.
Thank you, Councillor Shukat. Anne, would you like to respond to that?
Yeah, I'm afraid the answer is that we don't yet fully know. So that first year is going to be important. It is an assurance framework. It's intended to be positive and supportive. I'm not aware that there is a punitive element to it as yet. It's still being co-produced. There are still lots of workshops and lots of discussions taking place about the process and about any implications of it. So I'm afraid the answer is we don't yet know.
Okay, thank you, Anne, for that. Nobody else has indicated. So, sorry, Councillor Hutchinson.
Yeah, sorry, just a brief, Chair. I wasn't able to find much mention about the role of unpaid carers and the support that they require in the system, and how much that would be assessed, because obviously they're becoming an increasingly important and essential part of our overall care service, but they have needs of their own, and to get the most out of it. And I just wondered whether where they fitted in with this kind of assessment framework.
I think Jill's going to hopefully answer that one. You just on mute, I'm afraid, sorry.
Apologies, Chair. Under the theme of people, it's really clear that the CQC inspection framework will want to look at our carers strategy, and will want to talk to our carers and seek feedback from them. So it will be really important that they, about how valued our carers feel in Calderdale as part of that wider system, and how they are supported and able to access services for themselves. So yes, it will be a key part of the inspection framework.
Thanks for that clarity.
Thank you, Jill, and thank you, Anne, for answering those questions. So nobody else has indicated, so a few items coming from that. Certainly, we put the social care reforms onto the work programme, which is the next item, and just some of the things to think about for future. So to bring a report to Scrutiny later on when we're further down the line, and to also provide the whole members with a briefing, either seminar or something to bring them up to date, so everyone knows what's actually happening, so it's not a surprise to anyone. And then the last thing for me is to potentially look at some voluntary type framework for councillors to be involved, as in children's services. I think it was would be a great idea to be proactive, so that when the CQC do come in and say, oh, actually, we're an authority and we're doing this, before us being forced to do so. So on that note, I will close this item, and we'll now move on to the work programme. So the work programme has been distributed. We've now put the social care reforms onto that, which we desperately need. It's probably changing by the hour, and probably will change by the hour over the next few months. I'm sure it's not constant. Bella or Lauren, do you have anything else to add to the work programme that's not already been included?
I don't think so, no.
Okay, I'll just bring in Councillor Barnes.
Thank you, Chair. Yeah, we just need a revision on the National Drug Strategy when that's going to be done, don't we?
We do indeed, yeah. So just make a note of that. Other than that, I think that ends the work programme. We're always open for suggestions for things to go into the work programme, and always my door's always open, so you know where we are. Councillor Hutchinson, you put your hand up.
Just the detailed reviews at the end of the work programme, into dentistry in Calderdale, mental health services in Calderdale, and ethical commissioning. They're all down as pending, and I was just wondering when they might move from pending to timetable.
I think we're waiting on various things. I know Mike's away on holiday at the moment, but I think we're waiting for various people to come back to us as to where we can.
We can pick that up with him and then report back to the board if that helps, Chair.
Yeah, it certainly does. So on that note, nobody else has indicated to speak. So once again, a special thanks to Anne for attending the first meeting and being so
thank you, Anne,
with her answers. I think it's absolutely excellent interim we have in with yourself, and thank you, Jill, for also attending, and members, of course. Enjoy the rest of the evening. I'm now going to officially close the meeting in record time of 50 minutes, or 48 minutes actually. So